Welcome back to News in Focus. Now, the South African Human Rights Commission has raised concerns over allegations that some foreign nationals are being barred from accessing healthcare services at clinics and hospitals due to their documentation status. The Commission insisted that denying anyone healthcare services is a violation of the Constitution and a threat to human rights values of South Africa. In a statement, the Commission explained that the main issue has been the rising number of complaints that public health facilities are turning away patients, especially migrants and asylum seekers, on unlawful and discriminatory grounds. Joining me now from the South African Human Rights Commission is Commissioner Sandra Makoasha. Commissioner Makoasha, thank you so much for joining us here on News in Focus on Hilaal TV.
It's a pleasure. Thank you for welcoming the Commission.
No, it's an absolute pleasure. Okay, so Commissioner Makoasha, Action SA, of course, who raised the concerns when it came to migrants and asylum seekers using public hospitals. They've, of course, quoted that the quote-unquote misapplication of Section 27 of the Constitution has overwhelmed clinics and hospitals, placing the well-being of South African citizens at risk. I just wanted to get the Commission's comment on that.
Clearly when we look at Section 27, it says everyone has access to medical, must have access to public health care. It does not discriminate. So I'm quite taken aback by Action SA's interpretation of Section 27. But looking outside our Constitution, the South African government has signed 2 international treaties in terms of international law, as well as regional treaties, which states that we as a country will then allow those who are within our borders access to health care.
Commissioner Makoasha, I mean, let's talk about, obviously, when the reports came through to the SAHRC with regards to these migrants, these refugees, however you'd like to term it, that they were going to hospitals and they were being turned away. And of course, what was the way forward with regards to that?
Firstly, that is a clear violation not of only the Constitution, but the rule of law, which provides that citizens should not take the law into their own hands. So while we understand the frustrations of the general public regarding the failing infrastructure of public health care, the lack of available medication, as well as the high vacancy rates, which results in, at the end of the day, those who need to be provided with access to healthcare services not being given sufficient access to medical care. So that is the problem, the systematic issue. So turning away a small percentage that use these healthcare services would not deal with the systematic issues at all.
I want to point to a very similar statement that the Commission had released prior to the one of Action SA. And of course, mentioning everyone has an access to healthcare services, including reproductive healthcare. Healthcare providers, and of course the Constitution does make a reference, especially that of Section 27, to say, look, whether they are South African, whether they are not South African, they do have the right to health care. Now, has there been incidents where practitioners themselves, who of course signed an oath to obviously go ahead and provide health care, whether it's South African or non-South African, has there been incidents of that happening? And of course, has there been complaints that has been given to the SAHRC with regards to that?
Not at the particular moment. We have not received complaints. We have seen certain video footage that appears that there are medical practitioners that are turning away those who need access to medical care.
Okay. Commissioner Makoasha, I want to go back to the Action SA statement. They said that they're proposing a suite of constitutional amendments aimed at restricting access to healthcare for undocumented migrants. Now, my guest before from COSATU, of course, we're talking about the nationalization of the Reserve Bank. A very similar conversation in terms of these things do take time, especially when it comes to constitutional amendments. Is there a concern from the Human Rights Commission that this may occur, which of course limits a healthcare treatment for anyone that is outside of the borders of South Africa?
While we acknowledge Action SA's position that they would like to have amendments to the Constitution, it's quite difficult to amend our Constitution. What we're worried about is this narrative that it's so easy to change the Constitution. Specifically given our history, we really would want to still uphold the principles of Ubuntu, dignity, and treating all South Africans and those within the South African borders with equality and human dignity.
Commissioner Makoasha, the concerns, of course, of xenophobia does come in. Now, the reason why I'm bringing this is because I think both you and I know that the public healthcare system within South Africa is not the best at the moment. It's very volatile, it's very fragile, and of course, calls for NHI to be introduced, even though on paper it looks all well and good for universal healthcare. The questions with regards to public healthcare systems are, of course, something that I think is of concern. Can the public healthcare system in our country, as it is right now, can it still cater, in the SAHRC's opinion, can it still cater for both South Africans and also those who are coming outside of our borders wanting to seek opportunities within the country?
Currently, as it stands, as you said, those infrastructural challenges that the Commission has noted are a big challenge. But look at how it's supposed to break down. We have your full paying users who are those who are external funding, those who
medical
are on medical aid,
they're on medical
and those
aid, yes.
who are non-South African, who are citizens, who are visiting, who are on, who are tourists. So those pay for it, and then you have subsidized users, and then you have free services. So these are different categories of users of the medical system. And what we have noted is, due to the budgetary constraints, we are unable at this particular moment to assist everyone the way we want. And I think the Constitution clearly provides this idea of progressive realization of this right. Therefore, we really need to look into it and ensure that when we do provide medical assistance, we do also address those systematic changes. The Commission is writing reports. I think in June, we met with the MEC in Limpopo regarding the current structural challenges we noted in Tilidzini. So we are hoping that through proper implementation, experts on the ground, we are able to turn around the situation in the health care.
One final question, Commissioner Makoasha. Any discussions that have been taken to a higher level, especially that of government to the presidency, to raise these concerns that obviously the SAHRC have brought about?
Currently, we have limited our discussions to the respective provincial MECs. We are also monitoring the situation in order to determine whether we should escalate it not only to the Department of Home Affairs, South African Police Service, but also the Minister of Health. Okay.
Commissioner Makoasha, absolute pleasure having you on. Thank you so much for joining us.
Thank you. Always a pleasure.
That's the South African Human Rights Commission Commissioner, Sandra Makoasha, was discussing the comments that were made by Action SA with regards to them saying, well, there has to be a limitation to foreign nationals using healthcare facilities. The South African Human Rights Commission says, take a look at Section 27. It must be respected. What do you, the viewer, have to say with regards to that? Well, that's all we have for you here on News in Focus from myself, Ross Patel, and the rest of the team in Johannesburg. Assalamu alaikum wa rahmatullahi wa barakatuh.